Greetings. I'm going to be talking about the danger signs of pregnancy today. And going straight to the point, what are the danger signs of pregnancy? Danger signs of pregnancy simply means the signs or symptoms a pregnant woman will see that will make her rush to the hospital. They are emergencies. When you hear danger, it means it is an emergency. It's better we even put it the emergency signs of pregnancy. It's better that way. So when you see these signs or symptoms, you are expected to rush to the hospital. So, and I'm going to be telling you about 10 danger signs of pregnancy. Number one is bleeding. They call it antepartum bleeding, right? Bleeding during pregnancy. Irrespective of the form of bleeding, irrespective of what is causing the bleeding, rush to the hospital. Once you see any blood, irrespective of the volume, whether the blood is small or it is much, it is an emergency. Rush to the hospital. This bleeding can be caused by a threatened abortion, right? A complete abortion or a placenta abruption. It's a sign when you bleed during pregnancy, it's a danger sign that is telling you that all is not well. So rush to the hospital. Number two is severe vomiting. Anytime you are vomiting too much, don't just stay at home and be taking all type of medications that come your way. Anything you put in your mouth, you vomit. You vomit more than 5 times in a day. You are dehydrated. You are tired. You cannot even stand up from bed. You are weak. Straight to the hospital is a danger sign of pregnancy. You get. And one thing about this is that there are cases where some women, because they vomited too much, they become very malnourished and anemic. It even affects their baby because any folic acid, the only routine drugs they take, they will vomit it. So there are cases where some pregnant women have had children with spinal bifida because they have this excessive vomiting. Excessive vomiting during pregnancy is known as hyperemesis gravidarum. Number three, severe abdominal pain. Severe abdominal pain. Your tummy is paining you. All of a sudden, you just notice that your tummy is paining you. It's a danger sign of pregnancy. It may be that you are about to have a miscarriage. Right? You are about to have a miscarriage. And going back to bleeding, sometimes we mistake, you will just be spotting, you would think it's implantation bleeding. You are not the one to make that diagnosis. Whether it's implantation bleeding or not, go to the hospital, let your doctor see you and say, oh, this is implantation bleeding. Now, back to what I was saying. If you are having severe vomiting, severe abdominal pain in pregnancy, it's a danger sign. It may be that you are about to have a miscarriage, a threatened miscarriage, a threatened abortion, or even an abortion has happened already. So you go to the hospital. Now, if you also notice that you are having severe abdominal pain, tummy pain, and you are bleeding, it's a telltale sign that something is wrong. Rush to the hospital. Number four, headaches. If you notice that your head is always paining you, you cannot sleep at night, you're having headache, especially frontal headache in front of your head like this. Sometimes the headache is around your head. You are always having severe headaches. Please rush to the hospital. If you are a pregnant woman always having headaches, may just be that she has preeclampsia, right? It may just be a sign of that. One of the first signs of preeclampsia, headaches. So when you get to the hospital, your doctor will check your blood pressure, your nurses, they will check your blood pressure, they will do urinalysis for you to be sure that it is not preeclampsia. Number five now, if you another one of the danger signs of pregnancy is swelling. You just notice that you are swelling up your leg. Yeah, leg swelling most times is normal. But when you notice that your legs are swollen, your hands are swollen, your face is swollen, that may just be that your kidneys are failing, right? I'm not scaring you. It may just be a telltale sign that something is wrong with the kidneys. And most time it's because of preeclampsia, elevated blood pressure in pregnancy. So rush to the hospital. When you get to the hospital, they will check your kidneys, they'll do your kidney function test for you, they will do urinalysis for you. They will also check your blood pressure to be sure all is well. Right? Those are danger signs. When they say danger signs, I want to also tell you that there are signs that If they happen and you don't do anything about them, it can lead to the death of the baby. So I want to also add that definition. It's not just that it's an emergency. It's an emergency that if nothing is done about it, can lead to the death of the baby and or the mother. You understand? So that's danger sign of that's what danger sign of pregnancy means. Another danger sign of pregnancy you should take note of is okay. I've mentioned bleeding. I've mentioned severe vomiting. I've mentioned severe abdominal pain. I've mentioned puffiness. Right? I've mentioned headaches. Yes, leaking of water. All of a sudden, you just notice that you are just pouring water. That is your amniotic fluid that is pouring out. So rush to the hospital, right? It just means that you have had a membrane rupture, an amniotic membrane that's ruptured. Is you are leaking water. Whether it's because of labor or it's not because of labor, hospital directs. Yes, hospital directs. A baby cannot survive in a womb that has no water. Yeah? Baby cannot survive in a womb where the amniotic sac, amniotic fluid have all leaked away. So that's why you must rush to the hospital. That's number 6 I've mentioned now. Another danger sign of pregnancy that you must take note of is when you notice that you are having fever. It's a danger sign of pregnancy. People don't talk about it. Fever is one of the commonest cause of miscarriage outside chromosomal abnormalities. Fever is one of the most common cause of miscarriage. So any form of fever, whether it's from malaria, it is from urinary tract infection. Urinary tract infection is notorious for causing a miscarriage, right? It's from pneumonia, right? Whichever way this fever is coming from, some of you will have chicken pox, measles during pregnancy, it's an emergency. Rush to the hospital, right? Rush to the hospital for the fever to be taken care of. If any pregnant woman that have convulsion in pregnancy, you have convulsion, seizures in pregnancy, is a danger sign of pregnancy. When a woman have convulsion in pregnancy, it may be that the woman is epileptic before, but she is not taking her medication. That's one. Or the woman's blood pressure is so high. Sometimes a woman's pregnant woman's blood pressure can be so high, it will not reflect. The woman will not even know. The woman will not know. All of a sudden, the woman will just start convulsing. And it's a danger sign of pregnancy. Any form of single convulsion, rush to the hospital. I've mentioned 6 now. I've mentioned 6 danger signs of pregnancy. Now, other danger signs of pregnancy I would like to mention: a woman that is involved in an accident. Whether something touched your tummy during the accident or something did not touch your tummy. As far as you were involved in that accident, it was a motorbike accident or a vehicular accident, whatever type, you fell. Especially if you fall, electric shock you in the house, or you fell in the house, electric shock you, or a car hit the woman, or motorbike, or the woman fell from a bike, whatever. The first thing you should do is go to the hospital. Go to the hospital so that the doctor will evaluate you and check whether there is anything wrong with you and the baby. That's why they will do a scan for you. Right? Accidents during pregnancy is a danger sign of pregnancy, and you must go to the hospital. Now, women that are, what do I call, there are some women with some special conditions like sickle cell anemia, right? Asthma. Pregnant women with special conditions like sickle cell anemia, asthma, right? Time you feel that something is wrong with you, rush to the hospital. Because sometimes the danger signs of pregnancy, like you notice you are not breathing well, right? Or you are having crisis. Those are danger signs of pregnancy. In that special group, rush to the hospital, right? Then all of a sudden you just notice that your baby is not moving again, or your baby is now moving too much, right? The baby is now moving too much. Baby used to move 5 to 10 times in a day. Now the baby is moving 30 times. That's a danger sign. It may just be a sign of fetal distress. Now, the baby that used to move 5 to 10 times a day, 12 times, all of a sudden the baby is moving once or it's not moving at all. That's also a danger sign of pregnancy. You must rush to the hospital so that they will insist that if you notice it, don't just let the doctor or the midwife tell you everything is okay, go. No, insist that they will do a scan for you. Insist that they should do a scan for you. So that they will do a scan for you to put your mind at rest that all is well with you and the baby. Right? Okay, I've mentioned abdominal pain. I've mentioned, okay, do you know that appendix can also be the source of abdominal pain? But it's your doctor that will determine that. Which other danger sign of pregnancy have I not mentioned? Okay, I mentioned bleeding. I mentioned severe headaches, fetal movement, reduced fetal movement, or too much fetal movement. I mentioned convulsion. I mentioned now. I mentioned convulsion. I mentioned uh, swell, puffiness, your body just swelling up. Now, if you notice that your eye is always turning you, you are so weak, your eye is always turning you, you can't do anything. For you to move from here to here, you feel like as if you want to faint. That's a danger sign of pregnancy. It may be that you are anemic, right? That may just be a sign of anemia. You get? That may just be a sign of anemia, and you must go to the hospital to sort it out. I think I will have to stop here. I mentioned close to 10 already. And please, one thing I want to beg you is always share my video so that it will get to a wider group. There are a lot of pregnant women that don't even know about this page. Anytime you come in contact with this page, share it so that many people will know about it and they will be educated. You get? So that my dream is for Nigerians or Africans to have educated pregnant women. When I mean educated, it does not mean that you didn't go to school. It means that you know that you are pregnant and you know what it entails and how to go about it, so that we can help reduce maternal and child mortality. Thank you, and bye bye. Bye bye.